$300,000. That's the latest estimate on out-of-pocket healthcare costs in retirement.
That number doesn't even include long-term care.
How to develop a plan to pay for the healthcare costs right now on Retiring Today.
Welcome to Retiring Today. The latest numbers are in and it's expensive. That's the bottom line. Healthcare costs could be up to $300,000 for those 65 and older during retirement. So how do you pay for it all? I'm here with Loren Merkle. He's a certified financial planner, a certified financial fiduciary, and a retirement income certified professional. And Loren, $300,000 for healthcare. It's a staggering number.
It's a staggering number, and that doesn't even include long-term care costs, which is a concern of a lot of pre-retirees and retirees. We just saw a study, Molly, recently that addresses the long-term care costs from 65 and beyond. It was anywhere between $100,000 and upwards to $170,000 a year for long-term care, added on to just traditional health care costs. So as somebody looking to go to retirement and hopefully stay retired for 20 to 30 years, you look at these numbers, you see these studies and say, how am I ever going to pay for all of this? Because that's just the health care, long-term care, but you still want to have fun. You still want to travel, you still want to see the grant, you still want to do all these things which cost money as well. So it's kind of mind-boggling to think about how are you going to afford all of these different things you want to do and all of these different things that you have to do. And this is where the retirement planning really comes into play, not only to help guide you to those answers, but also make you feel really good about the position that you're in and have confidence in these decisions you have to make.
Yeah, so we talk about why it is so expensive. And the study that we're quoting is a Fidelity study. They talk about people living longer. They talk about healthcare costs rising quicker than general inflation. You know that if you're going to the doctor right now, whether you're retired or not. And the other thing that's a little bit surprising, Loren, is the average retirement age. It's younger than I would have guessed.
Yeah, the average retirement age is around 62, depending upon whether you're male or female. But it is younger than most people think, especially when we look at the open health care insurance costs. A lot of people think that prevents people from retiring prior to Medicare age, which is 65, but on average, people are retiring prior to that. And there's a lot that goes into it. Some people, they want to and are able to retire prior to that. Some people are forced into retirement, whether it's because the employer forces them into retirement, they eliminate their position, or because of health issues where they can't work anymore. So there's a lot that goes into that number, but the one thing that everybody has in common is they still have expenses. They still have these grand expenses they have to figure out a way to pay for, and that's what we have to figure out.
And there is a lot that goes into retirement. Today we're going to focus on just one of the guiding principles, but I think it's worth kind of setting it up that if you're getting close to retirement, maybe in retirement, there's really 5 pieces that you need to kind of have in place. Again, today we're just going to focus on one. We're
going to focus on one, but what we're going to find, even though we're focusing on one, is we're going to cover some of these other different principles because they're all related. What you do from a healthcare standpoint, I mean, you need to figure out how to pay for this $300,000. Well, how you do that has a lot to do with how you structure your income plan. And how you structure your income plan has a lot to do with how you structure your investment plan and your tax plan. So those are the 5 guiding principles: income planning, tax planning, healthcare, long-term care planning, legacy planning, and investment planning. They're all interrelated, and the decisions you make on one of those will impact the others. But healthcare today is a big concern.
And just kind of an overarching conversation about healthcare. So I hear numbers like $300,000, that's a lot of money. Anyway, slice it. I don't care what you have saved for retirement, $300,000 is a lot of money. Do you find that once you write this all into a plan, it doesn't feel like quite as much money because you can also see how, yeah, there's a piece over here for that trip you wanted to take. Here's a piece for that second home. Or does it really take a big chunk of a retirement income and it's just kind of the facts and the reality that people have to live with?
A little bit of both, depending upon your situation. But where we have to start is here are all the income sources that you have. Maybe you have a pension, you have Social Security, you have some investable assets, and you think about how are we going to maximize all of these from an income standpoint, but then we think about other strategies we can incorporate that can make the most of the income, like if you can figure out strategies to pay $250,000 less in taxes over the course of your retirement, well, that almost pays for the $300,000 right there. If the decision on Social Security, one decision that you make is $100,000 less lifetime income from Social Security than this decision, well, that's $100,000 that can go towards offsetting that cost as well. I mean, if we look at Social Security and you add up the monthly benefits you could receive over the course of your projected retirement, it could be $750,000 to over $1 million. So it's a big deal. Even if you have a starting retirement portfolio of $500,000 or $5 million, it's a big deal. And it can go a long ways. If you maximize those sources, it can go a long ways to help pay for the health care.
Okay, so if you're getting close to retirement, you're hearing this number, and by the way, I'm going to tell you this, we followed this Fidelity study for quite a few years. I know you followed it for a long time. The number keeps going up. It doesn't keep going down. So if you're getting close to retirement, we're projecting obviously clearly that this number will continue to go up. There are some things you could do right now to start kind of getting you ready for paying for healthcare and retirement. What are they?
Well, first is, when do you want to retire? Is it going, because that's going to determine what kind of health care you have available to you. Do you want to retire at age 62? You're not yet Medicare eligible. Well, your health care options are going to be different. Your health care costs could be different. Are you waiting until age 63 and a half, where now you have Cobra Insurance that could carry you the 18 months to age 65, which could be less expensive than the open market healthcare coverage option? Or are you waiting till 65 and beyond, where now you have Medicare and you have to sort through this maze of Medicare options that are at your disposal as well? So first we have to identify, when is your retirement target date? And then we can sort through the abundance of options that you may have to narrow down what that's going to cost you, and then from there we try to figure out how you're going to be able to afford it.
Okay, first let's talk about one option that can get you started thinking about saving for this healthcare cost, and it's the HSA. It's a very powerful savings tool.
The HSA is an investment option that you have that can deliver income in retirement to help pay for this healthcare cost. The HSA, we did a complete show on the HSA. We deemed it as one of the superheroes of your retirement plan because it has the triple tax benefits, meaning that when you contribute to the HSA, you don't pay taxes on that contribution. It grows tax-free, and as long as you take it out for qualified healthcare expenses, it comes to you tax-free, so you can then have a lot more spending power with this money that you've saved and then taken out to help pay for this healthcare cost. You can contribute right now, if you're eligible for the HSA, up to $3,600 per year per individual that's eligible. And if you're 55 or older, add an extra $1,000 on top of that. So potentially $4,600, maybe times 2, that you can contribute per year towards this superpower, this superhero that could be involved in your retirement healthcare plan.
Loren mentioned that we did a whole episode on the HSA. You can go to YouTube, then search Merkle Retirement Planning to find that episode and go in depth on an HSA and how it can really boost your retirement savings. Another thing you can do right now, depending on your age, of course, if you're over 50, is start those catch-up contributions. You mentioned it with the HSA, but there's some other places to do catch-up contributions as well.
Yeah, the other superhero is the Roth IRA and even the Roth 401k plan. You make contributions that are on an after-tax basis to the Roth IRA, Roth 401k plan, and then it grows tax-free forever. So you take this money out 15 years later, 20 years later, 6 years later, it all comes to you tax-free, again, increasing your spending, your purchasing power. The catch-up contributions are, if you're 50 or older with the Roth IRA, you can contribute an additional $1,000, so $7,000 total. If you're 50 or older with the Roth 401k plan, you can contribute an additional $6,500, making it a $26,000 contribution that you could make to a Roth 401k plan. So if you feel like you're a little bit behind on your savings, or even if you don't feel like you are and you have this discretionary income you can apply towards your retirement savings, what an incredibly powerful way to put that money to work, where you can take out later tax-free, pay for health care, pay for your travel expenses, pay for really any of the retirement expenses that you have or want to have throughout the course of retirement.
And we're talking about chipping away at this $300,000 cost. You talk about how a Social Security election can do that, the right Social Security election, the right tax planning strategy. Also those catch-up contributions, really if you just look at starting them when you're 50, you can put an extra $140,000 in your pocket.
Yeah, you certainly can. If you're looking between age 50 and then retiring at 65, an extra $140,000 away, and if it's it's on the Roth side, that's tax-free, which is even more meaningful to you. So you can save a lot of money in a hurry. And some people, they get to the age of 50 or 55 and they don't really feel retirement ready from an investment portfolio standpoint because they see these staggering costs, and maybe you have $300,000 in your savings and you're thinking, how am I going to do this? And really you have to think about how compound interest really works. And it's really the last couple doubling periods that the vast majority of Americans generate most of their retirement wealth. Because when you have $100,000, if your portfolio is expected to double every 10 years, let's say, you have $100,000, it doubles over a 10-year time frame, now you have $200,000. Well, that's meaningful, but it's not as meaningful when you have $300,000 at the age of 50, and over the next 10 years it doubles to $600,000. And then the next 10 years it doubles to $1.2 million. So it's that last two doubling periods that a lot of people really generate that wealth. So if you're sitting there and you have less money than you think you should have at an age that you think you should have more, well, don't despair necessarily. Put that plan together, and you can see how this can all come together as you go through this next phase of your life.
We've only been talking for about 10 minutes, and Loren's already given us some really good information on HSA and how to start getting ready for healthcare costs in retirement. So imagine if you had 15 minutes to talk directly with a retirement planner. Here's a great opportunity. It's a complimentary 15-minute retirement checkup call. You can go to the website on your screen right now and schedule one today. We still have more great information about how to boost your savings when it comes to paying for healthcare in retirement when Retiring Today continues.
You've heard stories from your family and friends. You may have even received a few calls from sales agents who want you to purchase this plan or that plan. Misinformation about Medicare is everywhere. How do you know what's important and what's just noise? Join us for a complimentary educational Medicare workshop on Wednesday, August 11th at the FFA Enrichment Center in Ankeny at 6:30 p.m. Spots are limited due to social distancing guidelines. Register now by visiting merkleplan.com.
Women face a unique set of challenges as they travel to and through retirement. From investments and caretaking to increased longevity and healthcare expenses, women face it all. How do you manage these concerns and also fulfill your retirement dreams? Join us at Jasper Winery in Des Moines for a fun and informative evening on Wednesday, July 28th at 6:30 p.m. This special workshop is designed for women, taught by women. Register today at merkleplan.com.
Welcome to Retiring Today. We're talking about the cost of healthcare in retirement. The latest study shows $300,000 for healthcare in retirement, and that doesn't even include long-term care. So I'm here with Loren Merkle. He's a certified financial planner, certified financial fiduciary, and a retirement income certified professional, which means all of those titles mean that this is stuff you're talking about every day, Loren. And so we're trying to talk to people about, yeah, you see the number, it's big, it's a lot of money, but there's some strategies that can make it feel like a lot less money. So let's talk about how to pay for healthcare in retirement, especially if you're retiring at 62 before you're Medicare eligible.
Yeah, if you want to retire prior to Medicare eligibility, we need to look at some of the different options that you have to be able to incorporate healthcare within your, because you know you need healthcare. So now it's a matter of what options do you have. One of the options that you may have available to you is Cobra Insurance. Now, 12 years ago, we would not be having this conversation about Cobra because it was the absolute last resort, because it was so expensive compared to other healthcare options. Today, it is a real viable option for many people to carry them 18 months after they retire from their employer. So if they had qualified coverage, if you have qualified coverage at your employer, once you retire, you have 18 months that you can stay on the Cobra Insurance. Now, the way that works from a cost standpoint is you still get the group discount that your employer was offering before. You just don't get the employer subsidy. So when you were working, your employer, let's say your total health care cost for you and your family was $1,000 a month. The employer may have been covering $600 a month of that, and then you were on the hook for the last $400. So when you're on Cobra Insurance, the employer is not going to pay for that $600 a month, but you still get the group discount. So you pay for the full amount, but you are still involved in that group receiving the discount, which a lot of times is less expensive than if you were going to go to the open market and just get your own individual health care coverage.
And this Cobra is kind of a government act of sorts, something that the government put into place. So does that mean it's available to everyone who had coverage, or you said qualified coverage? What exactly does that mean?
Yeah, anybody who had qualified coverage through their employer is eligible for Cobra. So it is a program that the government has put into place, which makes eligibility almost mandatory for those who had that qualified coverage. And if you were married and you had qualified coverage, your spouse was on that coverage, and you retire, then your spouse typically has that option as well.
Okay, and so again, before you maybe look at private insurance or the public market, another option that seems kind of obvious, but it's a good reminder, is to look at your spouse's plan if your spouse is still working.
Look at your spouse's plan. If your spouse is still working, then maybe you can go over to your spouse's plan, and that could potentially be less expensive than going to the individual healthcare market as well. So that is a real viable option. Again, if we're retiring prior to Medicare age, we have to come up with something. There are multiple options. We look at what kind of quality of coverage you will receive from that option, what the cost is, and compare them to make sure we're making the best decision.
And then of course there's the public market and the private market, things you have to look at as well.
Yeah, and again, it comes down to what are you going to receive from a quality of coverage? What would you have to pay for that coverage? We need to take into consideration what your retirement activity plans are. Do you plan to travel? Do you plan to travel domestically? Do you plan to travel internationally? How does your coverage cover all of those types of desires that you have or plans that you have? And we need to make sure that you have the right health care that you need based on your activity plan, and then we get the least expensive option for the quality of coverage.
And then you turn 65 and you celebrate, right? I think most people that turn 65 go, this is gonna be better because you're Medicare eligible.
Once you turn 65 and you make your Medicare decisions, then you celebrate. But
Yeah.
it's really about age 64 that people really start to get the nervous sweats, because your mailbox starts to get bombarded with all of these Medicare supplement options that you have, and that's really when you start to realize all these different options that you have with Medicare. And what those options mean is you have to make a decision. You have to evaluate each one of these options, the good, the bad, the pros, the cons, the cost, and then make that decision. And that's why Medicare planning is so integral to the overall retirement plan, because there's a lot of options. Many times we talk about the 81 different options people have with Social Security. Well, with Medicare, it feels even more enormous than the Social Security decision as well.
And to understand it all takes a lot of time and a lot of effort. And the neat thing is, on our team, we have somebody who's putting the time and the effort into understanding all these things. Because
of the complexity and the importance of having the appropriate coverage throughout the course of your retirement, we have a Medicare specialist on our team, and that's what she's dedicated to, is helping our families make the best decisions, not only at point of 65, point of initial election opportunity, but also on a yearly basis, because you can make changes to your supplemental coverage on a yearly basis. And these plans change. So evaluate it at point of 65, initial enrollment, but also a continued evaluation to make sure that you maintain the proper coverage for the proper price for you as you go through retirement.
We recently did an episode with the director of Medicare here at Merkle Retirement Planning. Her name's Anne Marie Morrow. She sat down with us and we went over the difference between Medigap plans and Advantage plans, and we talked in depth about electing Medicare. So go to YouTube, search Merkle Retirement Planning, and you can watch that episode as soon as you're done watching this one. Now it's time for our Ask the Advisor question. Here it is. How is nursing home skilled care handled by an Advantage plan? Does the Advantage plan pay for skilled care? We'll answer that question. We'll talk about an opportunity for you to learn about all of the pieces of the retirement puzzle and more when Retiring Today continues.
When planning a big trip, do you like to look up points of interest, read restaurant reviews, or map out how to take the scenic route? You may spend days or even weeks getting ready for a week-long vacation. Well, what about the 20 or 30-year journey that is retirement? Join us for a 2-part online complimentary workshop, Journey to Retirement, July 27th and 29th at 6:30 p.m. What you can learn from the comfort of your own home in these online workshops will help you plan for the most exciting journey of your life. Register today at merkleplan.com.
I feel like a ton of bricks has been taken off my shoulders. They know so much about everything. I'm getting information about Medicare and Social Security. the Merkle retirement team really knows what it is doing. They knock it out of the park with timely responses and empathetic handling of sensitive issues. Thanks for everything you do, Merkle Retirement Planning.
Welcome back to Retiring Today. Here is another look at our Ask the Advisor question. This one came into us just recently. The question is, how is nursing home skilled care handled by an Advantage plan? Does the Advantage plan pay for skilled care? Loren Merkle, what would you tell the viewer who asked this question?
There's a lot of if-thens that go into this that we really can't cover right now, but on the high level, basically, the Medicare Advantage plan can cover components of the skilled or parts of the bill of the skilled nursing care, but there could be some co-insurance that you have to participate in and some hospital deductibles that are involved as well. So you want to make sure that you understand how it really works, how your particular Advantage plan or your original Medicare can cover these types of things. And this is why we have a director of Medicare on our team, because this is what she does. She will look at what your coverage is, what your coverage options are, what your concerns are, what you need to have within your overall Medicare and retirement plan, and then make sure that you have the best potential plan possible.
So what he really should have said was, call Anna Marie Morrow today for more.
I think I kind of did say
Yeah,
that,
you did basically. Did. All right, one thing I do know that you know a lot about is long-term care, because it's one of the 5 guiding principles of the Merkle retirement method. It's something you write into many, and if not most, of the retirement plans that you put together here at Merkle Retirement Planning, because we know that the facts are such that long-term care is something people at least have to be prepared for.
They have to be prepared for it because it can sink their retirement ship if we don't have that within the plan. And there's lots of different ways that you can plan for long-term care. Many people are choosing to self-insure long-term care expenses, and it's not necessarily because you want to, but what other options do you have? You're aware of the traditional long-term care insurance, but you've probably heard some really bad things, or maybe you've seen your parents go through a real bad experience with traditional long-term care, so you're wondering, what is the best option? There's some other options out there for you, but you know that the risk is real. I mean, just today, and let's go through a list of some of these costs just to kind of unveil what this might look like, not only now, but also 20 years down the road. So from the home health aid, this is cost from home health aid. Community assisting living, we're looking at the year 2020 and then 2040. In 2020, the average cost of that monthly was $4,576. If we fast forward with inflation, 20 years from now, in the year 2040, it'd be over $8,200 a month. So again, that's for community and assisted living. Adult day health care, looking in 2020 about $1,600, in 2040 about $3,000 a month. Assisted living facility, about $4,300 as of 2020, and $7,700 a month if we fast forward 20 years. And you can see down the list there, and we go down to the private room, which is the most expensive, $8,800 a month, versus 20 years from now, almost $16,000 a month. So you look at those numbers, and you look at the resources that you have now versus what you think you might have 20 years from now, and that becomes real alarming for many people. So now we have to figure out how to build those numbers into your plan to make sure not only you receive the care that you want to receive, deserve to receive, but also if you're married, how does your surviving spouse still have the retirement that you guys had dreamed about after those expenses, after you have passed away and those expenses you've already incurred?
Yeah, the latest stats are that 7 out of 10 people that are age 65 and over right now will need some form of assisted living in retirement. So we know it's expensive, just like we know healthcare is, but don't worry, there's some good news. You can put together a plan to pay for it if you should need it. What are some of the things that you talk about families with?
Well, we have 4 main options. We can self-insure, and that does work for a lot of people. And self-insuring is basically you're paying out of pocket for all of these expenses you may have. If this is the route that you choose to incorporate, make sure you still have it in your plan though. Make sure you still have it in your plan that in the year 2040, when you're 80 years old, you need long-term care and you need an extra $15,000 a month. You have an idea of where it's going to come from, and you have an idea of how that's going to impact the surviving spouse's rest of their retirement as well. And then that could offer you some confidence because you can see it works. You can see it works, and then you don't need to invest in some of these other insurance programs, or you can see it doesn't work, and now you've undressed that real risk for you when it's not too late. because now you can still take action to plan for it in a different way. So another way that you can use is traditional long-term care insurance. You're probably more familiar with that route. You purchase an insurance policy through an insurance company, and they promise you to pay a certain benefit if you experience long-term care later down the road. Maybe it's $4,000 a month, maybe it's $6,000 a month. The disadvantages with that type of strategy is this is what we're seeing, is that insurance companies are increasing the premiums, sometimes even each year, substantially. And you don't know if you're ever going to need long-term care. So if you never need long-term care, you pay all these premiums for 20, 30 years, never need the long-term care, and then it's kind of a wasted investment, if you will. I mean, you get the insurance, but you don't really get anything in return except for the solace that you have long-term care expenses covered. So if that doesn't appeal to you, then another option would be a life insurance long-term care hybrid. And the way that that works is it is life insurance. So if you pass away, it pays a tax-free death benefit to your beneficiaries. But if you need long-term care, then and a lot of them work in many different ways, but as an example, you can advance that death benefit 20% per year for up to 5 years. After 5 years, then that death benefit policy has been exhausted, but you can structure that to offset as much or as little of the long-term care risk as you want to. So as an example, if you purchase $1 million death benefit, 20% per year means that you can take $200,000 per year and apply it towards long-term care if you need it. So if you need long-term care for 2 years, you've consumed $400,000 of the million, you pass away, then the beneficiaries receive $600,000 tax-free. So the benefit of that is the premiums are locked in. So day one, you know exactly what you're on the hook for from an expense standpoint from year to year. And the other thing is if you don't need long-term care, somebody's going to get the money because the beneficiaries are going to get the money. And that's a pretty common way to go for a lot of people today.
Today we've only talked about healthcare, really. We've just covered that guiding principle of retirement, but there's a lot more to talk about. There's a great opportunity to dive into many of the other pieces of retirement. It's the Journey to Retirement Workshop. There's a website on your screen right now. You can go there right now and see when a Journey to Retirement workshop is that works for you, and it's a great opportunity to learn all about taxes, healthcare, investments, income planning, legacy planning, and more. Also, we'll continue talking about all of those things on this show. It's Retiring Today, and we thank you for watching.
Women face a unique set of challenges as they travel to and through retirement. From investments and caretaking to increased longevity and healthcare expenses, women face it all. How do you manage these concerns and also fulfill your retirement dreams? Join us at Jasper Winery in Des Moines for a fun and informative evening on Wednesday, July 28th at 6:30 p.m. This special workshop is designed for women, taught by women. Register today at merkleplan.com.
Thank you so much for watching Retiring Today. We hope you've enjoyed the show.
See you next week.